so I did this at the last minute, so I hope you appreciate that. I like data. This meeting's awesome, but it's 90% opinion. I like data. And this is a great systematic review meta-analysis that was done with level 1 and level 2 studies, the best data that we have for rotator cuff issues. And we want to know why cuff repairs fail. Well, the big question is, when do they fail, right? So one question is, most of the repairs that we do fail early. They fail within the first 3 months. Some go later than that, but most of them fail within 3 months. If we want to look at who's at risk for failing, older people. This is age greater than 60 versus age younger, and over 60, they fail at almost twice the rate of people younger than 60. This is a graph showing by every 5 years, and you can see once you get past about 60, 65, the rate of failure goes way, way, way up. So older people definitely are at high risk. This systematic review also told us that tear size produces failure. If you have larger tears and massive tears, they fail at substantially higher rates than smaller tears and medium tears. With fatty infiltration, it's interesting. We worry about fatty infiltration. We worry about that. We know that larger tears have more fatty infiltration. We know that there is a relationship between fatty infiltration and re-tear rates after you repair a cuff, but surprisingly, the relationship's not that strong. If we look at the global fatty degeneration index and look at all the data in the literature and compile it, the repair rates really aren't that much different with fatty tears and non-fatty tears. And from the original Goutalier study, they used a global fatty index of 1.43 is what their criteria was. And if you divide them into one smaller than that, one's bigger than that, fatty infiltration surprisingly didn't really do much. So these are the things that are important. And the ones in red are highly significant. Age and tear size are the key. Fatty infiltration, maybe not so much. So who's at risk for re-tearing?